Millions of Americans are desperate to travel, especially college kids, for spring break, like UC Berkeley student Melanie Parks, who's going to Hawaii with 3 friends.
Because I feel like this will be really good mentally for me, because I've been feeling really overwhelmed with school and just staying home all the time.
Some universities are concerned enough that they canceled spring break, but UC Berkeley is not one of them. Instead, they sent students a list of recommendations to follow if they do travel out of the Bay Area, like getting tested before and after the trip and self-sequestering for 10 days when you return home. But Stanford Healthcare infectious diseases specialist Dr. Dean Winslow says the pandemic isn't over yet and there aren't enough people vaccinated to let our guard down.
As sad as it is to say that, I think right now is not the time to have the spring break experience.
Melanie tells us she and her friends chose Hawaii for spring break because of the state's tight COVID restrictions and the number of outdoor activities they can do when they get there. Dr. Winslow agrees outdoor activities are far less risky, but not risk-free.
I'm going to be getting a COVID test, and it has to be negative within 72 hours of traveling.
UCSF infectious diseases expert Dr. Monica Gandhi recommends you choose a place like Hawaii if you do travel, and says you should be very careful, though, along the way.
I am not saying don't go anywhere. I'm saying please maintain masks and distancing as you go, because I understand people's needs to see each other, and we still need to keep these restrictions on until we get to mass vaccination.
The Transportation Security Administration is reporting a spike in travel since vaccinations have ramped up, and the agency is now asking to hire 6,000 new airport security screeners because it expects a very busy summer travel season. Anoushah Rasta, NBC Bay Area News.